Hello, I'm Haley Jadu, and I'm presenting the study low-dose 5-MAPB does not alter anxiety-like behaviors in a rodent elevated plasmase. I'm an undergraduate studying at Western Michigan University, and I conducted this study with two of my classmates, Sabrina Passioni and Joshua Morrow, as part of a research practicum in behavioral neuroscience last spring, with the assistance of a graduate student, Rachel Burrows. The study was funded through a contract Dr. Lisa Baker has with Dr. Matthew Baggett at Tactigen. Anxiety disorders are a prevalent mental illness with medications often prescribed to alleviate its symptoms. Development of new medications is an ongoing research process. In recent clinical trials, MDMA demonstrated clinical efficacy in reducing PTSD symptoms. However, it is also a popular recreational drug known as ecstasy that poses a public health risk. Some side effects include high blood pressure and loss of consciousness in extreme settings. MDMA has also been observed to induce anxiety symptoms in some individuals. Benzofurans are a novel class of drugs under recent investigation for safer alternative therapeutic potential in preclinical behavioral studies. These drugs have similar pharmacological actions to MDMA. 5-MAPB is the benzofuran examined in the current study, which is structurally similar to MDMA, as illustrated at the top of this slide. The elevated plasmase is a preclinical behavioral test commonly employed to screen medications for anxiety-altering properties in rodents. Preclinical studies of MDMA in the EPM indicate that MDMA exerts anxiogenic effects at medium doses and anxiolytic effects at high doses in mice. Due to the pharmacological similarities between 5-MAPB and MDMA, some research efforts have focused on comparing the behavioral effects of these drugs. MDMA and 5-MAPB are monoamine releasers and transport inhibitors. A study by Fua and colleagues found that 5-MAPB produced significantly higher increases in mouse striatal monoamine concentrations compared to MDMA. Recent findings in our lab have also shown that low doses of 5-MAPB substitute in rats trained to discriminate MDMA. 5-MAPB has not been evaluated in preclinical studies of anxiety, so the aim of this study was to investigate single acute low-dose injections of 5-MAPB in a rodent EPM test. We used 24 adult male rats housed in pairs, as shown to the right, and our maze is a custom-built elevated plus maze with 2 open arms and 2 closed arms, as shown in the lower right corner. A camera was also mounted to record maze activity. 5-MAPB was provided by Tactigen and was injected 30 minutes before the test. Our rats were divided into 3 groups: a saline group, a 0.31 mg per kilogram group, and a 1.24 mg per kilogram group of 5-MAPB. The rats were placed in the maze and were allowed to freely explore for 5 minutes. The dependent variables we were looking for was time spent, entries, and explorations into the open and closed arms. For our data analysis, a 2-way ANOVA was conducted on each dependent variable, followed by a SIDAC multiple comparisons test. A 1-way ANOVA was then conducted on each of these measures with different scores between the closed and open arms, which was followed by 2 key multiple comparisons for treatment effects. Time spent, entries, and explorations in open and closed arms for each treatment group are depicted here. A 2-way repeated measures ANOVA indicates statistically significant differences between open and closed arms for all 3 dependent variables. The rats spent more time and made more entries into the closed arms, which was expected because rats are naturally anxious in novel open spaces and display a preference for enclosed spaces. Because no statistically significant difference was found between treatment groups, the drug 5-MAPB did not alter the rat's preference for the closed arms. Because there was a greater difference between time spent in open and closed arms for the 1.24 mg per kilogram group than for the other groups, we elected to conduct a secondary analysis on this difference. The calculated differences between open and closed arms for each of the dependent variables are shown here. A 1-way ANOVA on the difference scores only for time showed a statistically significant treatment effect. However, 2 key multiple comparisons showed only a statistically significant difference between the 0.31 mg per kilogram and 1.24 mg per kilogram treatment groups. Neither 5-MAPB dose produced a statistically significant difference from the saline-treated controls. Because there was no statistically significant difference in the elevated plasmase behaviors between either drug dose and saline controls, we can conclude that acute low-dose treatment with the drug does not alter anxiety-like behaviors in rats. This was a preliminary study with small dose sizes, so we cannot draw solid conclusions without more experimentation. We use lower doses because, as I mentioned earlier, our lab found that these low doses substitute for MDMA in rat drug discrimination. Lower doses are also commonly given for PTSD treatment and therapeutic purposes. Despite this, further research needs to be done with a wider dose range and other behavioral assays to fully characterize the behavioral effects of 5-MAPB and related benzofurans. Other studies using MDMA have used a larger dose range, so expanding on the experimental dose range in benzofurans is necessary for further development of these molecules for therapeutic potential.